Hi, Dr. Gans again. Before we start talking about endodontic problems, I refer you back to video number 1 so that you can read the disclaimer. Please understand that the information we present to you in each of these little videos is purely informational, since we have really no idea of who and what you are. We always suggest that if there's any bleeding, infection, or pain, that you certainly seek the help of a dentist immediately. Also, any of the suggestions that we make here should be passed by your dentist in general. But that being said, let's talk about some common endodontic problems that are faced by patients every day. The first is, I just had a root canal and I can't bite without pain. What do I do? Next, do I really need to have a post and cap immediately after root canal? Third, I'm in the middle of root canal treatment and my jaw is swollen. What should I do? And finally, my root canal dentist, or any dentist in general, gave me an antibiotic. I feel better. Do I need to keep on taking it? Let's answer each of these questions. The first one, I just had root canal and I can't bite without pain. What do I do? Well, first of all, stop biting. You know, it's the old joke, doctor, it hurts when I do this. Well, stop doing that. Well, just kidding, of course. Sometimes when root canal is either in its early stages or after completion, there can be an issue with biting pressure. This can be caused by slight swelling at the ends of the roots, which can cause the tooth to rise a bit in its socket, causing some biting pain. The tooth is actually lifted a little bit out of its bony socket, so it's the first tooth that you hit when you bite. Other than staying away from the tooth, there's really not a lot that you can do to relieve the problem. You need to call your dentist right away and have the bite adjusted. It's a very simple procedure. By the way, leaving this alone can only lead to more pain, so we do suggest that you get it taken care of right away. The next question is, do I really need to have a post and a cap immediately after root canal? Well, when root canal therapy is completed, you need to follow the advice of your dentist regarding the proper restoration of your tooth. That being said, when root canal is done, the nerve and blood vessels are removed from the center of the tooth. That's basically what root canal is. And then the dentist fills that space with a sterile material. Now, this process can lead to a brittleness of the tooth, which can, in the future, sometimes cause fractures. Now, there are several ways to restore these teeth, including placing posts and crowns. But the final decision resides with your dentist, since he or she has the best clinical information available. Next question. I'm in the middle of root canal and my jaw is swollen. What should I do? Well, first of all, swelling is never a good sign. It's usually indicative of an infection. So sometimes root canal teeth can become infected, and when infected, tissues can swell. It's important to call your dentist right away and have this situation evaluated before it becomes more painful and more difficult to treat. The sooner, the better. Swelling is one of the true emergencies in dentistry. Next question is, my root canal dentist gave me an antibiotic. I feel better. Do I need to keep on taking it? Well, the answer is typically yes. Just because you're feeling better doesn't mean that the problem is totally resolved. Medications such as antibiotics need to be taken for specific periods of time in order to make sure the actual or potential infection is properly managed. If you have any questions, you should certainly call your dentist. But please, don't stop medication on your own. You need to speak to a healthcare professional. This ends the section on endodontic problems.